Let's talk stroke volume. So stroke volume is something I talked about in an earlier video. Stroke volume is referring to the amount of blood that actually gets pushed out of one ventricle during one contraction. Right? Typically, we refer to the left ventricle, though the volume is very similar for the right ventricle. Why do we refer to the left ventricle, not the right? The left ventricle is the one that's pushing blood through the systemic circuit, so it's thought of as being more important because the right ventricle only has to squirt the blood to the lungs, right? Anyways, stroke volume. The unit of stroke volume is milliliters. The average stroke volume is 70 milliliters, which means that when that ventricle contracts, 70 milliliters is what's going out of the ventricle. Why is stroke volume important? Why am I doing a lecture video just on stroke volume? Well, if we can increase stroke volume, that means we're putting more blood into circulation, right? Which means more blood is delivered to the arteries and to the tissues that need it, right? So basically more blood is getting delivered throughout the body. So this is going to have a major impact on cardiovascular function. Decreasing stroke volume, on the other hand, means less blood is being delivered to our organs and tissues. So you can see how stroke volume is an important concept. So we want to talk about the things that affect stroke volume. And there are three main things that affect stroke volume: preload, afterload, and contractility. So let's take a look at each of these things. So let's take a look at preload. Preload is how much blood you can get into the ventricle before it contracts. So basically we're talking about end diastolic volume. Right before the ventricle contracts at the end of diastole, how much blood can you get in? Because we know Starling's law of the heart, more in is going to equal more out. So if we can get more preload in, we'll get more stroke volume out. And likewise, if we have a decrease in preload, then we'll have a decrease in stroke volume. So what affects preload? Ultimately, preload is affected by blood volume, venous return to the heart, and super high heart rates. So blood volume plays a role with preload because the more blood volume you have, the more you'll be able to get into that ventricle, right? So a lot of things can affect your blood volume, like hydration status. If you're dehydrated, your blood volume will go down, which means your preload goes down and your stroke volume goes down. Things that affect water retention in the body will also affect preload. So, for example, diuretics, which cause excessive urination, this will decrease blood volume because that water that's being put in the urine is being pulled out of the blood. And as you pull the water out of the blood volume will go down. Venous return to the heart will also affect preload. So I have another video on venous return to the heart, but here what's important to know is that if we can get more blood to return to the heart, we can get a bigger preload and a bigger stroke volume. One of the main things that helps to increase venous return to the heart is exercise. As we exercise, our skeletal muscles squeeze on our veins, pushing that blood back to the heart. The last thing we're going to look at is heart rate, and extremely high heart rates will cause preload to go down. And this makes sense if you think about it this way. If your heart's beating super fast, there's not enough actual time for the blood to get into the ventricle, which means your preload goes down and your stroke volume goes down. So really, really high heart rates, like over 180 beats per minute, which is more than twice the average amount. So average is 75 beats per minute. So this is a really high heart rate we're talking about here that will decrease preload and decrease stroke volume. Another thing that affects stroke volume is afterload. Afterload is a concept that students often struggle with, but hopefully after my explanation, you'll find it quite easy. Think of afterload as a hurdle that the blood has to jump in order to get out of the heart, right? We know that when the ventricle contracts, it's going to push blood into the aorta. But let's think about the pressure in the aorta, right? If the pressure in the aorta is really high, then the ventricle is going to have a hard time pushing blood into the aorta, right? And likewise, if the pressure in the aorta is very low, then that blood will do what it does. It'll flow from the area of high pressure, the contracting ventricle, to the area of low pressure in the aorta. So that's really what we're talking about, is the pressure in these major arteries that are attached to the ventricles. If the hurdle is bigger than normal, then what's going to happen? If the pressure is higher than normal in the aorta, our stroke volume will go down, right? So afterload is really referring to the load or the pressure that the ventricle has to overcome in order to get blood into the arteries. So let's take a look at these two situations, right? Here we have left ventricle are both the same size, but notice the aortas are different, right? This is a really big aorta. This is a really small aorta. So which aorta below will have an easier time receiving blood from the ventricle? And why? So if both of these ventricles squeeze with the same contractility, it's going to be a lot easier to get blood into this big aorta, right? You have a lot of low pressure area. It's very easy to get the blood to go in there. Here, this really small aorta, right? It's going to be harder to get the blood into that aorta. So this is representing a low afterload, and this is representing a high afterload. What affects afterload then? Afterload can be affected by hardening of the arteries or hypertension, which is high blood pressure. So let's talk about hardening of the arteries. Another name for hardening of the arteries is atherosclerosis or arteriosclerosis. So they're not exactly the same thing, but close enough for our purposes. When the arteries become hardened, they lose their elasticity. So arteries have the ability to expand and then retract back to their normal size. They're very elastic, right? When a high volume of blood comes into them, they can get bigger, and then when that blood leaves them, they retract back to their normal size. But if the artery hardens, it can't do that elasticity thing, right? It can't stretch as blood enters it. And if it can't stretch as blood enters it, then it's going to stay small when blood enters it, and it's going to resist the entry of the blood. It's going to be a high afterload. High blood pressure or hypertension is another thing that will affect afterload. So if we have a high pressure in the aorta, it's going to be harder for the ventricle to squirt blood into the aorta because blood likes to go from an area of high pressure to low pressure. So if you're trying to squirt blood from an area of high pressure to high pressure, you can see how that's going to be problematic, right? So hypertension or high blood pressure means that we're going to have a higher afterload and lower stroke volume. So a decrease in afterload will lead to an increase in stroke volume, whereas an increase in afterload will lead to a decrease in stroke volume. And to go back to like my kind of hurdle analogy, right? If the hurdle is smaller, you're going to run your race faster. But if the hurdle is bigger, you're going to run your race slower. Contractility is the last thing we're going to talk about that affects stroke volume. And we know that contractility is the contraction strength, the contraction power, if you will, of the myocardium. A higher contractility means a stronger push on the blood leaving the ventricle, which will mean a higher stroke volume. But what are the things that affect contractility? You already know this. We already did this in another video, right? Whatever affects heart rate also affects contractility. So things that affect heart rate affect contractility. So things that increase contractility include increased sympathetic nervous system signaling, an increase in the release of catecholamines, and thyroid hormone, right? A decrease in contractility will be caused by an increase in parasympathetic nervous system signaling, or a decrease or a lack of catecholamines, or a decrease in thyroid hormone. The chemicals that affect contractility are called inotropic agents. So we would say that an increase in contractility is caused by positive inotropes, whereas a decrease in contractility is caused by negative inotropes. But I don't think you're going to see inotropic or inotropes anywhere on an exam. But I thought I'd mention them in case you ever come across them in another class or in your readings. Okay, so in summary, if we increase contractility, we're going to increase stroke volume, and don't forget we also increase heart rate. If we decrease contractility, we're going to decrease stroke volume and also decrease heart rate.